contraception can be defined as preventing sperm and egg from uniting, while birth control means preventing birth from taking place. Traditionally, contraception and birth control are women's responsibility, but nowadays attitudes are changing due to a lot of factors. So it is the responsibility of both genders to do birth control and contraception based on their goals of having child.
Abstinence is a birth control method that is the only method that is 100% effective. Abstinence means not having sexual intercourse, and by practicing abstinence, ensure that a woman won't become pregnant because there's no opportunity for a sperm to fertilize an egg. Permanent contraception is divided into 3 sterilizations, which are vasectomy, tubal ligation, and hysterectomy. Vasectomy is a contraception method for a male in which vas deferens is cut and sealed. This will block the sperm from getting into the semen when ejaculate. Tubal ligation is a contraception method for female where the fallopian tube is being cut and sealed. The egg released by the ovary each cycle can't meet up and be fertilized by the sperm as the path that usually taken by the eggs are blocked. Hysterectomy is another contraception method for female where the uterus is being removed. By doing the hysterectomy, the ability to get pregnant and getting period is absent, as the uterus where the baby grows and the lining where it shed during menstruation is also absent.
The second method of contraception is called temporary contraception. There are 3 ways of temporary contraception. The first method is by preventing ovulation from occurring. It is by consuming birth control pills. Birth control pills contain a high dose of estrogen and also progesterone that can help to prevent pregnancy. So how does birth control pills work to prevent pregnancy? It is by inhibiting the release of eggs during ovulation. Next, it helps for the thickening of cervical mucus to prevent sperm from entering the uterus. Birth control pills also help for the thinning of the uterine lining to make it less possible for a fertilized egg to attach to it. The second way of temporary contraception is by preventing the union of sperm cells and also egg cells during fertilization. The first method is by using spermicides, which is to kill the sperm cell from entering the vaginal wall by applying the spermicide inside it. Next is by using the condoms. The male condom is a thin tube that is placed over the penis. The sperm cells are collected at the end of the condom, while the female condom is a vaginal liner that is inserted into the vaginal opening. Next is by using the diaphragm and cervical cap, which is a dome-shaped rubber cup with a flexible rim that covers the cervix and is placed through the vaginal canal. Lastly, women can also use the natural method of contraception, which is by determining a female's reproductive period to monitor the time sex to avoid fertile days.
Now, I'm going to talk about IUDs. What is IUD? IUD is an intrauterine device that is shaped like the alphabet that will be put inside the uterus. There are 2 types of IUDs, which are copper T380A made from copper and plastic, and there is progestered IUDs that are made from plastic and contain progesterone. Copper IUDs can last about 10 years, while progesterone IUD can only about 1 year. IUD works by preventing the sperm from reaching the eggs for fertilization, and the effectiveness of IUDs is about 19 to 96%. So now, we go to emergency contraception. There are 3 most common emergency contraception drugs. The first one is Plan B, which doesn't need any prescription from any medical professional. This drug works by preventing pregnancy after 5 days of unprotected sex, and it is more effective the sooner it takes after sex. The second drug is Ella. This drug is more effective than Plan B, but you need a prescription from a medical professional for taking it. The last one is Paraguay IUD, which is the device that the doctor or nurse will put into the uterus and will prevent 99% from pregnancy to occur. It works up to 12 years.
The ethics and application of birth control. Contraception in general is a core public health issue. First, it has the potential to reduce family size and improve birth spacing. But on the other hand, contraception may also damage the health of the individual using it through the side effects of the contraceptives. For example, oral contraceptives not only prevent pregnancy, but also reduce the risk of ovarian cancer. However, oral contraceptives also increase the risk of cardiovascular disease. Next, contraception also makes it easier for people to have sex outside of marriage and allows people to have more sexual partners. This, in turn, could increase the possibility of catching a sexually transmitted disease such as HIV. And last but not least, Some birth control techniques is also said to amount a form of abortion, as such that if abortion is wrong, then those forms of contraception must also be wrong.
Effectiveness of birth control method can be based on their failure rate. Implant and IUD has the higher effectiveness. Methods such as sterilization and condoms depend on the user gender, while methods such as fertility awareness can vary with method used. To conclude the video, there are many methods to control birth and pregnancy, all come with their pros and cons. Hence, young or old couple need to learn and find the most suitable method for their situation when family planning.